Hello everyone. So today I am going to be talking about chlamydia. All right. So chlamydia trachomatis is a gram-negative bacterium. So which means that it has a cell wall that appears pink when stained with a gram stain. It is an obligated intercellular pathogen, meaning it can only replicate and survive within the cells of its host. Chlamydia lacks peptidoglycan, a crucial component of the cell wall found in most bacteria, making it unique in its structure. Chlamydia trachomatis has several serotypes or strains with varying levels of virulence and clinical presentations. One of the main attributes of this bacterium is its ability to infect and target epithelial cells, particularly in the genital tract, leading to the common sexually transmitted infection as we know as chlamydia. Um, it has evolved specific mechanisms to enter host cells, manipulate host cell processes, and evade immune responses, which contribute to its pathogenicity and ability to cause infection. All right, some more transmission and epidemiology. Chlamydia is primarily transmitted through sexual contact, including vaginal, anal, and oral sex. It can also be transmitted from an infected mother to her newborn, leading to neonatal conjunctivitis and pneumonia. Chlamydia is a commonly sexually transmitted infection affecting both men and women. Adolescents and young adults aged 15 to 24 are at higher risk due to increased sexual activity. Some more stats of chlamydia in the world. Higher prevalence is observed in low and middle income countries where access to screening and treatment may be limited. In the United States, the CDC reported 4 million chlamydia infections in 2018. Chlamydia is most common among, again, people aged 15 to 24 around the world. Chlamydia is the most reported sexually transmitted infection in the United States, and it can't account for all the infections in the because some people are asymptomatic, so they don't have any symptoms and don't seek treatment or get tested. Some chlamydia statistics in the United States. So 67% of new infections occur among youth aged 15 to 24. 1 in 20 sexually active young women aged 14 to 24 has chlamydia. And chlamydia rates for African Americans were 6 times that of white Americans. Some preventions and treatment for chlamydia: using condoms, getting tested, and treatment. So the treatment is other than using condoms and regular testing for prevention, the treatment is azithromycin 100 milligram, one dose orally, or doxycycline 100 milligrams orally 2 times a day for 7 days. And depending on whether each of those two is used, one dosage of Herceptin is the first line of treatment, 500 milligrams intramuscularly, single dose, and it's an injection. All right, some symptoms of chlamydia. Most common symptoms include abnormal genital discharge, pain or burning during urination, rectal pain or bleeding if engaged in anal sex, and testicular pain or swelling in males. Chlamydia can also be asymptomatic, meaning individuals may not experience any noticeable symptoms. If left untreated, it can lead to serious health complications such as pelvic inflammatory disease in women and epididymitis in men. So routine screening and early detection is critical to prevent long-term consequences for transmission rates. All right, so culture and diagnosis of chlamydia. So the most common is the nucleic acid amplification test, which is the most sensitive and specific test for diagnosing chlamydia trachomatis infections. It detects genetic material of the bacterium in a patient sample. Sample can be collected from various sites, such as urethra, cervix, vagina, rectum, and throat, depending on the suspected site of infections. NATs can be performed using urine swabs or other specimens. Another test is nucleic acid probe test. These tests detect genetic material of chlamydia using specific probes. While they are less sensitive than NATs, they are still used in some settings where NATs are not readily available. And cell culture, though less commonly used due to the availability of the more sensitive NAAT tests, it can be used. All right, moving on to mechanism of infection. Chlamydia trachomatis has a unique intracellular life cycle that enables its pathogenesis. The infection starts when the elementary body, the infectious form of the bacterium, attaches to and enters the host epithelial lining of the genital tract. Once inside the cell, the EB differentiates into reticulate body and the non-infectious replicating form. The RB multiplies within a specialized compartment called the inclusion, avoiding host immune detection. Oh, right, virulence factors, adhesion. Chlamydia trachomatis expresses adhesions on its surface, such as the major outer membrane protein and the adhesion-related molecule, allowing it to adhere to the host cell. This is a crucial step in establishing infection. And then type 2 secretion systems. So chlamydia secretes protein via the type 3, secretion system, which functions as effectors. These effectors manipulate host cells processes, promoting bacterial survival and replication. Some effectors inhibit host cell apoptosis, while others modify the host endocytic pathway to prevent lysomal fusion with the inclusion. Intraprotein, this protein is essential for formation of the inclusion, the intracellular compartment where chlamydia replicates. It prevents the inclusion from fusion with other cellular compartments, shedding the bacteria from host immune responses. Liposaccharides, so chlamydia produces liposaccharides, a component of its outer membrane, which can stimulate pro-inflammatory responses. However, chlamydia's LPC lacks typical endotoxin activity, allowing the bacterium to evade strong inflammatory reactions and avoid immune clearance. The pathogenicity, the unique intracellular life cycle of chlamydia and its ability to avoid host immune responses contributes to the pathogenicity. It can persist and replicate within host cells, leading to chronic infections. This chronicity may cause chronic inflammation and tissue damage, especially in the genital tract, leading to complications like pelvic inflammatory disease and tubular factor infertility in women. And then host immune evasion. Chlamydia trachomatis employs several strategies to evade the host immune system by residing within the inclusion. Chlamydia avoids exposure to immune effectors, but in the cytoplasm, it also downregulates the expression of major histocompatibility complex molecules on the affected cell, reducing antigen presentation of T cells. Right, and those are my citations. Thank you very much.